Welcome to Virtua Health's RealTalk Women's Health Chat. I'm Bridget Reuter, part of the Virtua Health marketing team. Before I introduce our panelists, I have just a couple of quick reminders. Your camera and your microphone is disabled, but you can still interact with our panelists at any point in the presentation by typing your questions into the Q&A tab at the bottom of your screen. You also have the option to click anonymous before submitting. A recording of tonight's session will be shared with all of you through email in the next few days as well. So let's get started. We have 4 of Virtua's certified nurse midwives here to chat all about midwifery care in every stage of life. It's not just about pregnancy, who knew? It's from adolescence through to menopause and beyond. They have offices in Sicklerville and the brand new Midwifery Birth and Wellness Center in Voorhees. It is my pleasure to introduce Karen McAvoy Shields, Director of the Midwifery Birth and Wellness Center, Emily DePenning, Camille Eel, and Robin Hewlett. Welcome.
Thank you.
Hi, thank you.
Great.
Hi.
You all look fabulous.
Yeah.
So let me get my notes here. Here we go. So let's jump in. Let's talk about what is midwifery. I think we're hearing more about it lately, but it's not new, right? And most people probably associate it with pregnancy and natural childbirth, but there's a lot more to it. So tell us, what does a midwife do?
You want to go first, Karen?
I was too, but you know.
Okay, I'll be happy to talk about it. Midwives have been taking care of people across the globe since the beginning of time. There have been midwives in every nation and every culture, and the midwife was and is a person who is trained in physiologic occurrences in life. That's a big fancy word. Some people say natural instead, but it's just midwives are trained to help people with the changes that normally occur in life. Another big part of being a midwife is relationship building. So midwives are experts at developing relationships with people and with their families and helping them cope with life. And that can be stages like the one that you just mentioned, birth, or it could be as early as adolescence, all the way through menopause, and even at the end of life. There are also midwives that help people at the end of life.
So I could come to you for just my annual exam. You could serve as my gynecologist for my annual exams, or birth control or any GYN care. Is that something I could come and see one of you for?
So, absolutely. Midwives help people with their wellness needs across the spectrum. So it could be family planning, it could be screenings like a pap smear, it could be breast cancer screenings, it could be a flu shot. It could be, I'm thinking about getting pregnant, or I definitely never want to be pregnant.
Sure.
It could be a range of things, but what any person could be certain of when they meet with a midwife, they can bring any of their thoughts and concerns and have them thoughtfully considered, embraced, and midwives help people reach their goals.
Wonderful. So let's talk about pregnancy care a little bit. What makes seeing a midwife or having pregnancy care with a midwife different than a traditional medical care with an OBGYN?
That's a good question. I'm sorry,
I'm going to kick that one to Emily or Robin or Karen.
Sure, I can take that one. I think, medical lens traditionally is focusing on bodies, doing assessments, diagnosing an illness or disease, and then treating that disease. And when we lump pregnancy and birth and the labor process into that medical lens, sometimes it can become viewed as an illness or diagnosis that needs to be controlled or treated, when really it's just a physiologic, or as Camille said, a natural process that your body has the ability to do on its own. So I think the main difference between midwifery care and perhaps a medically trained physician care is that, we begin with a belief and a deep trust in that natural ability of someone's body to be pregnant, to labor, and to give birth. And we kind of view ourselves just as partners in that process to come and support what someone's body is already doing. I'd
So
say
is it considered natural childbirth? I've heard you use the word physiologic. What's the difference?
yeah, I would say, I mean, people mean maybe different things when using those terms. When I think when we in our team, speak about physiologic birth, we are just referring to trust in someone's body to labor and give birth on its own without intervention. And that can happen with medication or without. In our practice, especially with the birth center, we specialize in supporting people who want to give birth without medication, the unmedicated process, because often that helps people to feel more in tune with their bodies and to listen to what's going on, and to have freedom of movement. You can get in the tub, as you see behind Camille in the video.
Well, we talked, okay, so you mentioned the tub. So I see there's something going on there. Rob and Camille, you guys are all right now, you are in the Midwifery Birth and Wellness Center. That's correct. Really cool. So let's talk about that. This beautiful new center in Voorhees. I don't know who wants to jump in and start, but let's talk a little bit about what is this new birth center?
Yeah, I would like to talk about the birth center. This is my dream come true. This has been a 3 to 4 year process, actually. And I've been lucky enough to be involved from the very beginning, from the architectural design. This was really built with intent to make this a kind of an expanded home rather than a mini hospital. So we really went in to the design of this building to really, the minute that you walk in the door, just feel relaxed and home-like. Our practice side, when you walk into the waiting room, we have a fireplace and wood shelving, wood beams, comfortable furniture, and a little table for once COVID is better, for children to come in and play. The exam rooms are large enough when permitted families to also come in during the prenatal visits.
Wow, so it's an experience for the whole family, not just for the delivering mother. Okay, wow.
And the heart of the building is probably our community room. So where we hope to have support groups and classes, group prenatal care, really a place for the whole community to meet, not just pregnant women, but have teen programs, postpartum, menopausal programs, really get the community to be part of the birth center, whether they're pregnant or not pregnant, really. And then again, the birthing suites, which I think are all of our favorite areas. We do have 3 birthing suites. I'm in the blue room, and and Camille's in the green room, and Robin's in the purple room. And all 3 have large birthing tubs. We can provide water birth. There we go, Robin, great. Women, and birthing people can decide to get in the tub for a water birth, get in the tub for comfort. We have a huge bathroom with a walk-in shower. So, they can choose to be in the shower. We have something called an gym that hangs from the ceiling, where women can hold on to that and squat, or they can hang their belly into a sling for comfort.
What's it called? What kind of a gym?
Called a gym, like
yoga, meditation. Okay.
Really does help us, with positioning of the baby. And, we're really, as midwives, we're really big fans of movement in labor. That really helps the baby get into the most optimal position for birth, which then helps the body and the baby just kind of work together to help the birth go more physiological. And just that relaxed atmosphere without medical intervention really does, unless it's needed, obviously. But
quite different than laying flat in bed and laboring.
Yeah. And, another thing that I love about the birth center is that each birthing suite has its own outdoor space. And then that kind of, if you go out this little gate, it hooks up to a grassy knoll, and that hooks up to the walking path that goes around the entire campus. So we really did try to think of everything that would make birthing families feel really comfortable. And where Emily is, our family room, which has a mini kitchen and a table for gathering around and sharing a snack. We have a little area for toys. We have a desk if somebody needs to quickly do some kind of work, which we hope not, but we do have that available. So, it's really a great space for everyone. Really, we welcome everyone to come.
Well, it's just beautiful. I can't wait to see it. I know there's a grand opening tomorrow, so I'm very excited to get in there and take a look at this beautiful space. I should mention that there are some great videos on the Virtua website where you can actually get a virtual tour, and see all of the rooms and learn more about. I want to see this gym. I feel like I might be able to use that in my daily life.
Yes.
So talk to me about, can anyone deliver at the Midwifery Birth and Wellness Center? If someone's interested in this type of a birth experience, what kind of things do they need to think about?
Who would like to?
Sure, I can talk a little bit about it. The birth center is for people who have pregnancies that are low risk. So pregnancies that don't have complications that could impact birth. And we would be happy to talk to people individually about what that means to be low risk. That person who chooses the birth center would be someone who was not looking for an epidural, who wanted to have a physiologic birth. And there may be medications that we give here, like for instance, like antibiotics if a person would need that in labor. But we don't offer any kind of analgesia, no pain medicine in labor. So it would be someone who chose not to have medicine for analgesia. We do have the water, we do have gravity, we do have massage, we do have essential oils, we have energy, we have Reiki, and we bring our presence, our calming presence, and our knowledge and encouragement that your body can do just what it was born to do.
And I think it's important that this process of preparing for birth, for physiologic birth and birth at the birth center, is a ongoing process from the first prenatal visit until, we talk when you're in labor and decide when the best time to come in, because when you are admitted to the birth center, you are in active labor. This is, part of the process here is we want you really to be in labor when you're admitted so that your body really is in active labor. But that process continues, through every visit. And we're really trying to develop relationships with birthing families that come here. And our first visit is an hour long, and we really do a lot of teaching and really talking about, where are they in their life? What are they looking for? What are their hopes and dreams? We really try to come into this and meeting them where they are. Like, what is it that you are looking for? What is it that you hope will happen? What is it, what are you bringing with you? Like, do you have this fear, or do you have that fear, or so we really try to work on those throughout the pregnancy so that when you do have your birth, you are prepared and what, as best you can of what to expect, especially what to expect with a birth center birth.
Yeah, and I would add to that, folks who are looking for a birth center birth tend to be the kind of people who really want to be an active partner in their care. So, and I think that touches back on what we were talking about before in terms of what's the difference between midwifery care and a more medicalized model, right? We really, as Emily said, want to be partners with you. And there's going to be a lot of dialogue along the way. And on a practical level, our visits tend to be longer. As Karen said, the first visit will be an hour long, and then each of those routine visits along the course of the pregnancy is a half an hour, whereas often with physician practice, you might get 10 or 15 minutes with your provider, but we're going to be spending that time with you to really build that dialogue over time, get to know where you're coming from, and really provide a lot of that education that lets individuals take an empowered role in their own pregnancy and in their health. And then we hope that that really continues forward, not only during the course of pregnancy and labor and birth, but in terms of the kind of relationship folks have with their bodies and with their health over the course of a lifetime.
So it sounds like you really do get to know your patients. They get to know you. You spend a lot of time together, which is really important. I think, especially when you're entering into that kind of a setting, and you want that team behind you to know that you've got that support. It sounds wonderful. And even, I think, very interesting for patients who are not going to be experiencing a pregnancy, right? So would someone who is not necessarily coming to you for pregnancy care, would they also be able to, do you also spend that kind of time getting to know patients and helping them through their other needs?
Absolutely.
Yeah.
And first time they come see us as a GYN patient, we spend that hour to really develop a relationship and, again, find out, what they are hoping from this visit. What are they hoping? What are their health goals? What can we do to help them meet those? And we work in a partnership. We have, as midwives, have been doing shared decision making since, the beginning of midwifery. That's just always been one of our tenets, to really, it's a partnership. We're not there to dictate their care. We're really, it is a working partnership that, we work together to help them meet their goals. And then every annual GYN exam is their visits are 30 minutes, as well. If someone comes in for a problem or other issues, they're 30-minute visits. So really, it's a lot. It's a lot of time when you compare it to, a physician office, just because that is our philosophy of care, and we are able to spend that much time.
We also make sure that anyone who is entering a space with us, they can expect to be listened to, and they can expect tender, loving care every time.
Yeah.
Sounds like everyone needs a nurse midwife in their life.
You do.
I think so, yes.
I'd say so.
Every person.
And I want to say too, non-judgmental. I mean, we really love everyone. I mean, I don't use that word lightly, but really, I have to say that we love our patients. We really care about them and their families and their life, and what we can do to help, them along the way.
So let's look at the other end of the spectrum, right? So if we talk about pregnancy and then menopause and beyond, and if we think about that in a more natural, holistic type of approach, can you talk a little bit about that and some ways that you help women, through those phases of life? Because I find that I feel like traditionally there's a lot of medications that are prescribed without a lot of time to really sort of dig into underlying issues and concerns. As someone who's entering perimenopause and a little confused about all these changes happening.
Well, and I think a lot of that is education. Some people come and say, all this is happening to my body. I just don't understand it. I went to my, primary care and they, thought it was in my head or whatever. But, I think that really education is key, and natural remedies. There's a lot of, natural remedies that menopausal people can, use at home. And it sometimes, if it's truly interfering with the symptoms are interfering with daily life, then sometimes we do have to use some medications for a short period of time. But it's a decision that we're not saying you have to do this. This is, these are your options, and what do you feel most comfortable with? We could try this natural remedy first. We could change, start different changes in lifestyle, increase exercise, changes in diet. So a lot of elements play into that.
And so you all have experience, you would be able to help guide someone through those other holistic. And Emily, it looked like were you going to add something earlier?
Oh yeah, I was just gonna say too, along with like the holistic aspect, I think we come into each visit, yes, caring about, the physical body and the physical symptoms, and, maybe, yes, we're gonna prescribe something for a yeast infection or medication, like Karen said, would be necessary. But then we have those longer visits. So often someone will come in for something that seems so simple as, I think I have a yeast infection, but then get to talking and hear about, maybe some lifestyle things that might be causing a recurrent issue, or, there's someone, you get to know people over, frequent visits, and we often end up just talking about their life, what's going on in their life, emotionally, relationally. And, one of the things I love is through that relationship, yes, talking about this physical problem, but then hearing about what their concerns are, in in their personal lives and helping them, making space to process that as well. And so I've had someone who was coming for a recurrent issue. And then she came back and she's like, oh my gosh, I was in that toxic relationship that I told you about before. And now I made this big life change and I feel so great. And I met someone, you know, and so we get to be part of those moments as well as like, you know, here's your prescription for whatever, or, you know, is this, so we take, you know, those simple physical symptoms and don't just look at that physical piece, but take the person as a whole and their whole community and environment and context that's impacting their bodies.
It's wonderful, right? Because it often does involve much more than just the symptom.
Yeah.
Mhm.
So, Robin, do you have a favorite part of your job as a nurse midwife?
Well, I think, you know, for me, a big part of what inspired me to pursue midwifery, I come from a background in community organizing and popular education. And part of what I really loved through that work, coming into contact with healthcare and recognizing, particularly in spaces where folks are gathering to address sexual and reproductive health, that there's really an opportunity for community building there, that, you know, this is something that often can be sort of untalked about or stigmatized, but when we come together, we recognize that we all have bodies and we all have these common issues that come up in our lives, and that, you know, there's an ability in midwifery to both address the individual need, and we have a lot of contexts in which we're working with individuals around their own personal healthcare goals or symptoms they're having, but there's also a lot of opportunity to build community through these sort of shared experiences, whether that's becoming a new parent and building a family, or the transition of menopause, you know, and often feeling very isolated in that, but there can be opportunities to sort of find that, like, I'm not the only one, right? So something that we've talked about for this practice in the future as we build out the birth center is the possibility of having group prenatal care. That's something that I've been involved in other settings that has been a really special way to, you know, provide education and also allow the folks that we're working with to build relationships with each other and really gain from shared experience.
That's wonderful. Now, I bet you all have a lot of great stories to tell. I'm sure you, because, but how about you, Camille? Is there anyone that, you know, comes to mind, a special moment as a midwife?
Just recently, I had a very special moment. I had my most senior patient come to me for a problem. She was 98 years young, and she was a nurse in her former career. And so I got to have a not just conversation about the symptoms that she was experiencing, but I got to talk to her about how she blazed a trail for me to be a midwife. And she fought battles for me back in the 60s and the 70s as a nurse in, you know, in a culture that wasn't so receptive for her. So that was a really special experience for me. And she even found time to teach me a couple things about anatomy. So it was just a really special visit.
She taught you?
Definitely taught me. Absolutely.
Our patients teach us things all the time. That's part of the wonderful thing about these relationships we build.
Right. The typical relationship. It's give and take and share all the time.
Are there any misconceptions around midwifery that you'd like to set straight?
Sure. Midwives are more than birth. People think about us and only in the context of birth, but again, we can't say it often enough that midwives can take care of a person throughout their lifespan for most of their wellness needs, and we can definitely connect them with the wider healthcare community for any needs that may be out of our scope.
Great. Anybody else have any favorite stories they want to share before we? I do want to talk about the tubs. I really want to know more about those tubs.
Sure. Well, as you can see, there's room enough for a whole family in there.
Well, let me just say a little bit about the tub in that I have wanting this particular tub since they were, you know, on the market, which has been quite a few years, and they come originally from England, and they are specially built for birth, and they are the roomiest tubs that I could find. And they have a color wheel inside that mix the water, about 12 different colors of water. So whatever, whatever color feels good at the time, we can have blue, we can have orange, we can have pink, we can have green, we can have, lots of shades in between. And it really, and when all the lights are dimmed and just that light in the tub, that little bit of color in the tub, it's just beautiful. And it really just sets the atmosphere for this like relaxed and beautiful. And my favorite way is to catch babies in water. I just think it's great for the birthing person and the baby, as the baby just is born into this warm water, and they just, we lift them up to the surface and they're just so calm, and they kind of like look up and see what's, it's just the most beautiful thing that I have ever seen in my life. It's just a moment that makes me a little bit teary, but every time it's just amazing. And then, just to have the mom reach down on, in the water and just bring that baby up to her is just amazing.
Sounds pretty magical.
It's totally magical. It's really, really
and
great.
Has a wireless speaker too, so there can be ambient noise or music, what the person prefers in the background. So it's really a birthing experience for all the senses.
Yes. And the other great thing is that, at a birth center, we do not have continuous electronic monitoring. So women and birthing people are not hooked up to all these monitors all the time and like stuck in bed because they can't move. So we listen with a Doppler, like we use at the office, to listen to baby's heartbeat. We have a protocol that we follow, and, to make sure that everything is fine with the baby. And we just, take a few minutes out every 15 to 30 minutes, depending on what stage of labor is going on, and listen to the baby and just make sure that everything is fine. So it's just much less intervention that is not needed.
So is there anything else like this, right? This is the only freestanding birthing center. Is that correct? Tell me a little bit about what makes your center different.
Yeah, in the Philadelphia, Southern New Jersey area, we are the only freestanding birth center. There are other freestanding birth centers in Northern New Jersey, but a few hours from here. So in this particular area, in Southern New Jersey, we are the first and only at this point. So that, and to be able to offer the community this, and the great thing is that across the parking lot is Voorhees Hospital. So if we do need to transfer for some reason, if the labor's not going like we thought it would go, or there's an emergency, we are minutes away from Virtua Voorhees, that has a CHOP NICU and has, laborist in-house if we need an emergency, C-section or something. Everyone is, ready and able to help us. And, we go to the hospital. So there is that really, it's very comforting to many people to know that you can see the hospital if you look a certain way, it's that close, it's just right. You don't have to go on 73. You're just right across the parking lot to the hospital. So I think that is, gives everyone a level of comfort, and, if you need medical intervention, then we have that very close. So I feel that's, something we're really happy.
That's really good to know. And I think that would put a lot of people at ease to know that you're that close to the hospital, should that level of care be needed. Yeah. There have been quite a few studies studying birth center births, and it's about 2% transfer rate for something that's emergent. So it's a low transfer rate or transport rate, but we are ready for we're always ready for an emergency. And that's part of our training, is how to handle emergencies and, do what is needed and stabilize and transport. Okay. That's great. Now, would one of you go with, if my pregnancy or my delivery were to need that level of care, would you stay with me in that process if I had to go to the hospital?
Yep. Emily, do you want to talk about that a little bit?
Sure, yeah. Yes, the most often a midwife would be going along in the ambulance with the laboring person. There may be an instance where if we have multiple people at the birth center, we would be, having one of our laborist midwives at the hospital who we work closely with, and the laborist physicians there partnering with us in that. But most often we will be transferring with the person, and all of us are at different stages in the process of training to be first assistants in a C-section. So if someone needed a C-section, we go right into the OR, we scrub, we gown up, we're right there at the table through the whole process. So we stay with you.
Wonderful. We are getting some great questions that are coming in from our audience members. So I just want to remind everyone, if you do have a question, just type it into that Q&A chat. So one of the questions here is, if I want a birth with a midwife, but I'm not considered low risk, or I don't necessarily want to deliver at the birth center, what are my options? Can someone still come and see one of you? Maybe Robin or Keneal.
Sure, I'll jump in. Yes, we do take people who are not low risk and for the birth center for planned hospital birth. So that may be a person who previously had a cesarean and now wants to have a vaginal birth. We could attend that person's in the hospital. And we do partner with physicians when needed to, and we also partner with maternal fetal medicine so that people have other complications that risk them out of the birth center. We're able to continue to care for them.
That's great. So one of our other questions here, in your practice, how do you accommodate for different gender identities?
Yeah, so I think I can speak to that. That's something that we're definitely very aware of and trying to work really hard to make an inclusive space that really welcomes anyone who is fits within our scope. So as midwives, we're specifically trained to take care of people who have uteruses. So that's one way that we can talk about things that isn't as gendered. Midwifery definitely comes historically from a place of caring for women. And I think a lot of midwives would speak to the fact that, caring for women is part of what they feel passionate about and what's brought them to the profession. But as a profession, we're learning over time, and we're recognizing that that language can be really limiting and can be exclusionary, and that there are folks who are transgender, gender nonconforming, who are completely appropriate for our care, and we extend a welcoming space to them as well, and are trying to be really welcoming, to create a safe space and to be inclusive in our language. You might have heard throughout the presentation, we try to talk about birthing people and families in general, to not make assumptions about what family structures might look like, using words like partner. And also when folks come in and establish care with us, trying to be really, inclusive of what is your gender, what pronoun do you use, how do you want to be referred to, what language do you prefer in terms of talking about anatomy, and trying to have that be part of our conversation so that we can make sure to make as inclusive and as welcoming and safe a space as possible. Midwifery, as we've talked about, is really about meeting people where they're at and being non-judgmental. So as much as some of our language and some of the history is limiting, I think we do really come from a place and a practice that with learning over time, we're able to really create an inclusive space for folks. So we hope that, if there are gender nonconforming and non-binary folks who are looking for care, that they could come to us and find an inclusive and welcoming space.
Wonderful, thank you. I have another question. I'm halfway through my pregnancy. How do I go about becoming a patient and scheduling a birth center birth?
So you call our office for an appointment for an initial prenatal visit. We do a screening on the phone that first contact us just to see if you're interested in the birth center birth to see, make sure that you meet certain low risk criteria. And then we would, the receptionist who answers the phone then shares that information, and we meet as a group of midwives and we review whether they're appropriate for a birth center birth or they would require a hospital birth.
So absolutely come see you and you'll help guide them through their next steps. Great.
Just let you know about our philosophy of birth in general is that we are a practice that really believes in physiologic birth. So and the body's ability to give birth. So we do not offer routine epidurals. So we're really focused on non-medicated physiologic birth. So that's, we're here to support women through, non-medicated birth.
All right, now we get to always the important question of health insurance. What type, do you accept insurance? And what should someone do if they want to make sure that it's covered? And then there's sort of a follow-up piece here. Is it more expensive than a hospital birth?
So I think I'll just take this.
I like to pretend insurance doesn't exist and we can do whatever we want, but that's how it goes.
Fantasy world.
Process of the enrollment in most commercial insurances. We're hoping, we are applying to be in Medicaid. That is usually a 4 to 6 month process before we are eligible to provide services for Medicaid recipients. So we're anxiously waiting for that process to be complete, but that will honestly be about 4 to 6 months down the road. We are currently in Aetna commercial plans, and we're applying to Horizon Blue Cross and Blue Shield and Cigna and some other major insurance companies. We hope to be enrolled in them in the next 30 to 60 days. So, keep checking the professional fee, the midwifery fee. We are in almost every insurance company for the professional fee. It's the facility fee at the birth center that we're still working out. So, and to have a baby at the birth center is about a third less to a half less than if you give birth uncomplicated at a hospital. So it's definitely more cost effective. You go home in an average of 6 to 8 hours after you give birth. You provide, again, a lot of education regarding early discharge planning and how to, take care of yourself and your baby at home in those early hours, following up with a pediatrician. We have a home health nurse that goes out to check on the mom and baby in 24 to 48 hours after the birth. So there is really, and to get your, family and support people involved in helping as well.
So very well explained. Thank you. All right, here's a good one. What happens if all 3 birthing suites are occupied and you go into labor?
So we do have a backup plan where we kind of have one of those big blow up mattresses that we would put in a community room for, and probably move someone who's delivered already to go into there until they're ready to go home. And then, may that happen, But with our volume of births right now, that's extremely unlikely, but we do have a backup plan, if that were to happen.
Great. So this is a question about sort of what interventions are you able to handle at the center and what would require a transfer?
So I can address a few, and then if you guys think of other things, jump in. Maybe one common thing would be a labor that's taking a little longer than normal, or a prolonged labor or stalled labor or something. And often that can be caused by many things, but sometimes it could be caused by the way the baby's positioned. Sometimes their heads get a little crooked or come a certain way, and it just takes a little longer. So we can try, there are many interventions we can do here at the birth center to try to help the position of that baby get in a better spot in the pelvis, come down, put pressure on the cervix, and then move the labor along. So we have different position changes that we can try. there's a thing called rebozo. You take a scarf, you can put it around the belly and kind of help sift the baby a little bit to get in a better position. So that would be an intervention that we can do here. Camille mentioned, if someone is GBS positive, which is a common bacteria we screen for in pregnancy, we can provide that antibiotic here at the birth center. While someone is in labor, we can place IVs. We can give fluids. That's another, if someone's really dehydrated, that can prolong the labor. We can give fluids in that situation. Whatever.
Perhaps after birth, baby might be experiencing some difficulty transitioning to being outside the uterus. And we all are trained in emergency support for babies, so we can help them breathe if they need that support. And most babies recover after about a minute or so. But if baby is having ongoing needs, we would transport to the hospital to make sure that they have all the respiratory support that they could need. Another one is if after birth, the birthing person has lots of bleeding. We all are trained to take care of a person with extra bleeding, but once we have that person stabilized, we might transport them to the hospital for extra monitoring overnight. But we have everything we need here to stabilize a person with excessive bleeding.
Thank you. All right, so COVID has really changed, obviously, all of our lives and put a lot of new processes in place that we all have to follow. So what kind of protocols are there at the center now, and how does that maybe impact, kind of what someone might expect for their birthing experience?
Well, we follow the visitation policies that the hospital follows, in that you are, your partner obviously can be with you, and also a doula. So we are limiting visitors in the labor and birthing process. The partner and doula do have to wear masks the entire time. The birthing person does not have to wear a mask. Once they get here, they are masked. We take temperatures and review symptoms to make sure that no one is symptomatic for COVID. And of course, we have the cleaning procedures and everything, cleaning in between patients that they would do at the hospital. So, but I guess that's mostly what we're doing right now.
And
So
everyone can be, I'm sorry for interrupting. I just want to mention that any person, provider that you encounter at Virtua would be vaccinated unless they had a health condition or they were exempted from the vaccine.
And so right now, all of our midwives and birth assistants are vaccinated. Fully vaccinated.
In normal times, right? If we can just imagine what life might be like, maybe someday, what would that room look like? Could you have, your aunties and your mother and your sisters in there? And do you recommend that, or it's really, how do you handle those situations?
Yeah, I mean, we actually were just talking about that today in the office. I think it's one of the things that we all love about this model of care. So often throughout the course of prenatal visits, family are involved. If there are siblings, often as midwives, we're having the sibling help use the Doppler to listen to the baby's heart tones during visits. So that's something that's very much a part of our typical day-to-day pre-COVID, is having families very much involved in care. And it's really up to the birthing family, who they feel comfortable having at their birth. And sometimes it's really like aunties and cousins and grandma and grandpa and the whole family. And other times it's, just the birthing person and their partner, or the, one other person that they want to have with them. It's really up to the individual and what they envision their birth experience to be like.
That sounds great. So let's go to some of the other, maybe non-pregnancy, and we have a couple of questions here about, a teenage daughter. If I have a teenage daughter, at what age do you recommend they should start coming in for a visit? And is that, I think we mentioned that in the beginning, that you start at adolescence. So is that a patient that you would see, and when do you like to see someone in their teens?
It would depend on their healthcare needs. If they were open to and wanted to see a midwife, we would meet them where they were, and we would develop a plan specific for their developmental needs and their healthcare needs. So I would say after age 10. In some cases, it could be earlier, but after age 10.
In our practice, we typically 14 is about the age that we start. Before that, we usually recommend they go to their pediatrician.
And I think it's important to mention at that age too, a lot of the care is very much just talking, getting to know the individual, getting to know where they're at, what questions they have, and establishing that relationship. Often the actual physical exam is very limited at that stage. Newer guidelines don't recommend starting pap smears until much later. So I think a lot of times there's sort of that mental or psychological barrier that if I go to a midwife or a GYN provider, that it may be very invasive or that might be scary. And we're really about sort of easing in and building that relationship. And there's no physical exam that's absolutely necessary in the absence of symptoms or, you know, a specific concern they're coming in with. If a younger person wants to just come and ask questions or get some information, that's totally okay too.
Mm-hmm. You help moms have that safe sex talk, birth control talk with their teens. Not asking for myself or anything. But.
Sure, I would love to.
We're happy to talk about sex.
Yeah. Or periods or heavy periods, whatever.
Contraception.
Yep. Mm-hmm. You're all very excited to talk about these things. I can tell.
And we serious because we really want them to have a truthful conversation. You know, they hear so many things from their friends in high school or, you know, middle school. And, you know, when they come in, sometimes they have, you know, questions that they are embarrassed to ask other people. And, you know, we build that relationship so they do feel comfortable talking to us about, you know, like, how do you really get pregnant? Or, you know, those kind of things like, can you get pregnant on your period? You know, like these things that people, you know, talk about at school that are misinformation. And it's, you know, it's really, I love, you know, talking to teens and trying to just, you know, dispel some of the myths and make them feel comfortable with their body and own their body and know that they can say no and know that it's their body and they have a right, you know, to say no if they feel uncomfortable or stopped or, you know, right. So that they really are in charge of their body.
So important. How about women, postmenopausal women and your experience level? I know, Camille, you mentioned a patient in her 80s. So how?
She was 98.
98, that's right. So would you say that that's also, you know, a phase of life that you also are very comfortable with?
Absolutely. And we often talk about continuing to have pleasure past most postmenopausal stages of life. Some people think that their lives, you know, their pleasurable lives end at that point. So we talk about different ways to experience pleasure. And, you know, people in their 80s are sexually active and they have new partners. So we talk about lots of different things. Again, we try to meet each person's specific needs.
Well, this has been a really great conversation. Is there anything that you feel like maybe we didn't cover or you want to make sure that people understand about nurse midwives? Favorite story before we wrap up?
Come see us.
We will listen to you.
So have you delivered a baby at the birth center yet? How many have we had a first birth?
Actually, Mom caught her own baby in the water and it was amazing and beautiful. And yeah, so we're really excited that we're here and open and catching babies.
Wonderful. I can't wait to come see it. Well, this has been just a great.
Rob is actually in the room where the baby was born.
Yeah, I was going to say right there. That's where that baby was born.
Now, do most moms want to use the tub? Is the tub is pretty much a reason for coming there? But you don't have to. Do you have to use the tub?
No, you do not have to. And you know, I think people that feel comfort from the tub, like if they don't feel well, you know, they get in the tub and relax. If they have bad period cramps, they get in the tub and relax. You know, those are the people that really love being in the tub. people that have this innate love for water enjoy that, but other people just want to be in the shower. They want to stand up, and we have these, the shower heads that you can take down, and, we can put the water directly on their lower back or wherever they feel like they need, that warm water. So the shower is also a great place to be.
Yeah. And some people use the tub not actually during the pushing and birthing phase, but earlier in labor as well for comfort. So for folks who think like maybe water birth isn't for me, sometimes the tub can still be really soothing and an amazing comfort measure earlier on in the process as well.
Some people prefer to give birth on land too. So we can use the Om gym for upright birthing if people are interested, or standing or kneeling, hands and knees in the bed. Midwives will meet you wherever you are. We catch babies in all positions.
Yep.
In there, over there, under there, everywhere.
Whatever it takes.
Right, for sure.
Well, this has really been a wonderful session. Thank you so much for your time. Like I said earlier, a recording of all of this will be shared with some helpful links with everyone in the next few days. If you do want to schedule an appointment with one of Virtua's fabulous certified nurse midwives, you can call Virtua Midwifery at the number on the screen, or go onto the website at virtua.org/midwifery. We hope that you'll all also join us for our next Real Talk Women's Health Chat. Is Listen to Your Gut, Navigating Through Your Digestive Health, on Thursday, November 11th at 7 p.m. It'll be a great conversation with a Virtua gastroenterologist and a dietitian. Thank you, everyone, for joining us. Thank you to this powerhouse panel of women. I just have enjoyed our conversation so much. So Karen, Emily, Camille, Robin, thank you for your time. Thank you for what you do for your patients and bringing all those wonderful little lives into the world.
Bridget, thank you so much.
Yeah, thanks for taking the time to talk with us.
Thank you. See you soon.
Bye, everyone.
Bye.
We'll see you soon.